Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
You know, Nita, I'm living it up.
Yay. Well, we want our listeners to live it up, and unfortunately, a lot of them are in pain. What kind of pain are we talking about today? We're talking about basically orthopedic pain. So are you suffering with joint pain, ligament pain, back pain, neck pain? Do you have knee pain, hip pain? Perhaps you have arthritis pain, maybe stiff joints, dull aches. You might even not understand the source of your pain or not be able to figure it out. So we take your calls on this program all hour long, so you can speak directly with Dr. Darrow, who is a specialist in this area and has lots of things to inform you about at 866-870-5752. That's 866-870-5752 right here in the studio. And I'd love for you to look at the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And the best part of all, when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. So if you want to know what that means, stay with us, because that book has 264 scientific studies. We're here Saturdays at 10 a.m., again at 1 p.m., and if you've been listening for a while and you want to call the office and make an appointment, that number is 800-300-9300. That's 800-300-9300. So think about how long you've been suffering with your pain, and don't hesitate. Our number in the studio is 866-870-5752. Would you like to go to Jeff, or did you want to say something?
Hi, Jeff. That's what I'll say.
Okay. Good start.
I like that. Thank you, Doctor. I appreciate you taking my call.
Yeah, thank you so much for calling, Jeff. The call screener says that you have an issue with your knee. So how long has that been going on?
Well, with both knees, it's approximately 5 years.
Okay.
And my right knee, I have bone on bone. I've had the meniscus, arthroscopic surgery on the meniscus on my right knee, and then years later, I've been having a lot of pain. So I've taken different injections, one to ease the pain, and two to put fluid in between the joint of my right knee. And then,
okay.
I'm sorry.
No, I'm understanding. I'm listening. I'm just waiting.
My left knee, I've been diagnosed. It has arthritis, and so they both cause. I work in a field where I'm on my feet close to 6-7 hours a day, 8 hours a day. Going downstairs is the toughest. Going upstairs is not too bad. The days that I take an inflammatory pill, it eases the pain, and I can go most of the day without any pain. So I have been told to possibly get surgery, a knee replacement on my right knee. This is bone on bone. And the first doctor I went to, when I was basically a consultation, 2 weeks later, I received a call from his office saying, "Hey, we're scheduling you for surgery." And I went, whoa. It was just to find out the relationship I would have with the doctor, see what he's done, and maybe, check on some of the background that he's worked on people.
Well, that's a good idea. Any doctor you go to, you should ask how often they do that particular procedure. whether it's surgery or anything else. It doesn't matter. You want to go to someone who does the most in your area. And if you're in an area where there's not much of it going on, you go to another area. As an example, I actually flew up to San Francisco from LA to have a surgery to remove a adrenal gland that had a tumor on it. And I checked all over the world to find the guy who had done the most and had a great procedure done, no problems at all. But way too many surgeries, as we all know, fail, especially in the musculoskeletal system. Knee replacements fail, meniscal surgeries fail in the knees, shoulder surgeries fail for rotator cuff tears. All over the body, these surgeries fail because it's a very, I'm going to use the word abusive type of procedure. And I know if you're a surgeon, which I was in training to do, we believe that the only thing that can heal is surgery. That's the culture. But we're finding out now, if you go to Google and you look up different surgeries and look at failure rate, or look at something like failed back syndrome, which means you had a surgery on the back and it failed, you'll find that the surgeries are not what we used to think they were. So now people are leaning more and more to regenerative medicine, which is something I've done my entire career since my residency at UCLA. I started actually doing it there, and my professors were not happy with me because I was the new guy doing a new thing, and I continued to do it because it worked. And I've treated people for the last 22 years or more, including myself. If you ever listened to the show before, you know that I've injected most of my own body because I was a heavy athlete in my youth, and I kind of blew every joint out and every tendon and ligament in my body. And I've injected, I've used stem cells on my knees and my shoulders. I've done other things, platelets on my other areas, my neck and back, my fingers, my elbows, my wrist. I've injected, lots and lots of places over the years. Whenever I injure myself, when I can't take the pain anymore, I go ahead and inject myself and heal it up. Every time I've injected myself, it's worked, okay? Sometimes it's been one injection, sometimes it's been several. I never know with the patient how soon they will heal or if they will heal. And the reasons people don't heal, typically the most common reason is because they quit too quickly. They don't finish the regime of how many treatments it's going to take to grow back the tissue. So these treatments we do of platelets from the blood or bone marrow, we get platelets and stem cells. We don't know how many treatments it will take. I choose my patients wisely based on, what I think is the people that will heal. If someone's not a good candidate, I had one yesterday. I had a woman come in and she had arthritis in her knees, pretty severe. And I said, I don't think you're a good candidate for this. And there were many other reasons for that. It wasn't just the knees in themselves. It was her personality and her ability to focus and her wanting to heal. And sometimes the healing has to be, you got to lose weight to get the pressure off those knees. And some people don't want to do that. I put people who are overweight and they have lower extremity pain on a ketogenic diet. You've heard of keto, K-E-T-O, where it's basically protein, vegetables, and very low carbs. And men will typically lose about 5 pounds a week, and women will lose about 3 pounds a week. I didn't ask you if you're overweight, but if you are, then start losing the weight now, because every pound above your waist in excess is about 5 pounds biomechanically on your knee. So if you're 10 pounds overweight, that's an extra 50 pounds. Not just your body weight, but an extra 50 pounds of pressure. If you're 50 pounds overweight,
I'm sorry, go ahead.
If you're 50 pounds overweight, that's 250 pounds of pressure on the knee extra besides your body weight.
Right.
And that actually causes arthritis. So I'm not saying you're part of that. I'm just saying that if you are, then lose the weight. Go ketogenic. You'll lose it fast. 5 pounds a week for a man, 3 pounds for a week for a woman is quick. and it's easy to do. It's usually what I do. I'm down to about 165 right now. I lost about 10 pounds in the last couple months doing keto diet. And I'm pretty thin as it is anyway, but I just wanted to really trim out as much as I could. My high school weight was 160 when I was a gymnast at 6 feet tall. And, I was pretty ripped up at that time. So that's sort of my benchmark, and people should think about that. As we get older...
Yeah, I'm about 215, and when I was in college, I wrestled, played sports, martial arts. So when I got out of college, I was approximately 185.
Okay, well, that's a good weight for you then, even now. So that's easy. I mean, if you're thinking about losing...
185 is a good weight?
Well, if that's what you were when you finished college, that's a good weight for you now. Why did you leave college?
I graduated, it went on, and here's my story. Working construction for 40 years, wearing construction bags as a carpenter, weighing anywhere from 25 to 30 pounds every day, actually, say 5-6 days a week, and lifting heavy materials and what have you. It took a toll on me. I'm 63 right now.
Well, I get it, but I'm saying, why did you leave college? In your mind, you should stay in college.
Hey, you know what? You're absolutely right, because it was a good time, Doctor. It was a good time.
Well, you see, to me, you create your reality. So my reality is I'm in college right now. I'm 73 years old, but in my mind, I'm 16. I started college at the age of 16.
I'm right there with you. I surf every weekend,
Good.
and I refuse to say I'm old.
Okay. Yeah, I mean, don't let the old man in. That's the way you do it. One of my patients taught me that. I had a guy in his 90s who was active in sports, and he looked great. He was thin. I said, "How do you do it, man?" He goes, "I don't let the old man in." So don't let the old man in. And I want to go over some issues that you mentioned. Bone on bone is a bunch of nonsense, okay? You don't have bone on bone, or you wouldn't be doing these activities you're doing. Bone on bone is like there's no cartilage on the joint and on the bones in the joint. That means you can't move it, okay? Now, there's other reasons beside bone on bone why you can't move joints. In the shoulder, you could have adhesive capsulitis, like a frozen shoulder. That doesn't, even if you have arthritis, that doesn't mean it's bone on bone. Don't get sucked in by these wonderful surgeons, and I say wonderful because they're amazing people, but don't get sucked in by their narrative, which is you need surgery. Most people that come to me need surgery but never had surgery and get healed. All I do is use cells from their own body to regenerate the tissue. So forget that bone-on-bone nonsense. That's old man talk. Yeah, get rid of that one. From what you're telling me, you're an active guy, and you've got some arthritis, and I think pretty much almost everybody who gets older has arthritis, but not everybody gets surgery, not everybody has pain. So don't lump yourself in a fantasy that doesn't work for you. If you're going to have a fantasy, which everybody does about their life, make up a good fantasy. Be youthful. Come in for regenerative medicine if you want to. If you have more questions that I didn't answer, you can call the office at 800-300-9300. I'll repeat it for you. Sounds like you're driving. It's 800-300. It's 800-300-9300. And for those of you folks who are listening and you want to talk to me right now, the phone number to the studio is 866-870-5752. I'm going to repeat it again, 866-870-5752. And I think I can answer most of your questions about, what to do, what not to do to save yourself from having needless surgery. And again, this is not a statement against the surgeons. I love surgeons, but I'm saying that most of these surgeries just should not be done anymore. There was a time when we didn't know anything more, great, but I have a lot of friends who are orthopods, And we fight all the time. They go, your stuff doesn't work. And I go, your stuff makes people worse. Mine doesn't.
Well, I prefer not having surgery. Okay.
Well, you already had one that failed. You already had a meniscus surgery, and now you're in worse shape. Anytime you have a surgery like that, they take out tissue that makes the joint unstable and makes it worse down the road. These surgeries create immediate arthritis. Immediate.
Yeah.
Now, you mentioned a couple other things. You had a shot of an anti-inflammatory, a steroid, usually cortisone. It can be dexamethasone. Any ONE is a steroid which kills the cartilage, so I wouldn't do that. And then you had one that lubricated the joint, which is hyaluronic acid, and there's all kinds of names for it, trade names, but that doesn't do it.
I've done well on that.
Well, you've done well on it, but it's not going to fix anything. It's just a lubricant, and I'm going to bet you.
It's a Band-Aid.
Okay.
It's a Band-Aid.
Okay.
What it is.
I'm going to bet you anything. I'm going to look in your knee with an ultrasound, and I'm going to see plenty of hyaluronic acid already in there without you getting injections. So I don't ever do those injections. They don't do anything. And that's my point of view. Everybody else can argue with me. I don't care. I just don't do them. They're worthless.
Right.
What works
do you
is...
recommend the PRP stem cells, or are they both the same? Or are they different characters?
Well, I want to have you not talk for a minute so I can finish what I'm saying, and I'll tell you.
I'm sorry.
When you take blood, you can get platelets from it, and that's PRP, platelet-rich plasma, but there's very, very few stem cells in the blood, so that's not going to give you the stem cells. When you take the bone marrow, which is really as easy as taking blood, it takes me about 15 seconds to do the procedure. Once the area is numbed up, I take it from the back of the pelvis. You get bone marrow, and then you get in the bone marrow, you get stem cells and platelets and a lot of other healing factors. So obviously the bone marrow is going to be a better healing, but everybody chooses for themselves. I don't tell people what they have to do. I educate them, and then we talk about what they want to do. Everybody's different, and I do what the patient wants. I look at it like this. I tell my patients, you're the boss, I'm your technician, so you're going to be in control of what happens. Okay? Do you understand what I'm saying by that?
Absolutely.
Okay. So talking to you here, I think you're in good shape. I think your knees can feel a lot better. I don't know if I can give you brand new knees. That's not something I ever promise anybody. And I don't promise anybody anything. Doctors should never promise because we don't know what's going to happen with the patient. I've had people completely heal many, many, many times, and they go bang themselves up again, and they go, it didn't work. It worked. You just didn't listen to my advice on how to take care of yourself. So
understood.
The reasons it doesn't work is because people are way too active and they won't let it heal, right? They're taking anti-inflammatory medicine, like ibuprofen, which blocks growth of tissue. We're trying to heal the tissue and grow it. We're not trying to break it down. Maybe they don't get enough treatments. Maybe they're going to a doctor who doesn't use an ultrasound to guide the needle to see where it's going inside the body. And I'm going to put it like this. There's a lot of bad docs out there that do this. There's a lot of chiropractic clinics that talk their patients into getting this done, and the chiro will hire a doctor for the day to come in or bring a nurse, and they don't know what the heck they're doing. And this is what I said to you in the beginning. Anytime you go to any doctor, find the guy who does the most. If you want to get good results, go to the doctor who does the most of that procedure. Not the guy who comes in once in a while, goes to a weekend course and tries it out and does it once in a while. All right, Jeff, God bless you, man. I think there's good hope for healing your knees and making you feel a lot better. I don't think you're that bad off. I know you don't have bone-on-bone arthritis, so take that thought out of your head right now and put in the thought of you're going to heal, okay?
I got it. Doctor, I'll be calling you to set up an appointment.
God bless you, man. The phone number to the office, again, is 800-300-9300, 800-300-9300. And for those of you who want to talk to me right now, I'd love to talk to you at 860-5752. I'll repeat it, 866-870-5752. Nita, what do you got to say for yourself?
Well, I'll repeat that phone number because that's a pretty important element here in the studio. You can speak directly with Dr. Darrow at 866-870-5752. That's 866-870-5752. And you can check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing these treatments on videos.
Also, anybody who calls me up on the show gets a free book. I'm holding it in my hand. Those of you watching the video being filmed right now can see it is an amazing book. It took me 5 years to get all this research together. Doctors would always complain when I would lecture. You'd always get a couple orthopods stand up and go, "Where's the research?" Well, here's the research, guys. And guess what? Most of it is done by orthopedic surgeons. So I don't know why orthopods don't read their own journals about this stuff. We know that we grow tissue by doing regenerative medicine using stem cells and platelets. There's a lot of orthopods who are starting to do these procedures now. But I'm going to be honest with you. They don't believe in it. And they'll do one treatment and go, "See, it didn't work." And then they'll say, "Now it's time for surgery." I have buddies who do that. And they say to me, "I did it on somebody. It didn't work." It doesn't work like that. It's like filling a hole with dirt. How many shovelfuls does it take? I don't know. Everybody's different. On my own body, some things I've injected, like my wrist and my shoulder, have healed overnight. Other times, other parts of the body have taken several treatments. Anna, we're going to go to you before the break here real quick. This is Dr. Marc Darrow. What's up with your knee?
Hello?
Hi, Anna. Dr. Marc Darrow,
Yes,
what's
hi.
happening with your knee? How long has it
Hi,
bothered you for?
Okay, I have osteoarthritis of the knee,
Yep.
and I was interested in the stem cells. Do you think it will be possible for me?
All things are possible, but I need to examine you to tell you. I can't tell you on the radio.
Right.
How long has your knee bothered you for?
Oh, for a very long time, and it's worse every day.
Okay. Have you had a surgery on it?
No.
Okay. Can you
Just
walk?
therapy and exercise.
Good.
I can walk, I can bend my knee and everything, but it's very painful.
Okay. It's painful, but
And
just
I
the
was
fact
reading
that...
about the stem cells.
Okay. Stem cells may be a good treatment for you. Platelets might be a good treatment for you. The mixture using your bone marrow is the best treatment. I'd have to examine you. If you want to come to the office, the number is 800-300-9300. You can get in, call right now. They'll talk to you.
Okay.
It sounds to me like you're not bad at all. And I know you have pain, but pain's not an indicator.
Very bad pain.
Yeah.
Very bad pain.
Pain is not...
Especially when I walk.
Okay.
When I walk.
Yeah. Pain is not an indicator of getting surgery, though, so be careful. Do not get seduced into a surgery. It is not a good thing, okay?
No.
Not for somebody like you.
I try to avoid that. Yeah.
I think we can help you. I can't tell you till I examine you, but from what you're telling me, you're not that bad off and should be able to heal up, okay?
Okay, I hope so, yeah. Yeah, because, nothing helped, the only thing that relieves a little bit of the pain is ice.
Yeah, well, that's good. That's good. Especially if you're feeling better with ice, I'm pretty sure I can help you. You can go to the website and watch the procedures. You can see me injecting a knee, see if you like it. I've got videos on the website of me injecting shoulders and necks and backs and wrists
I
and
had two
feet.
injections. I had 2 injections of the acid.
Hyaluronic acid, yeah. Yeah, well, that's not going to fix anything. I'm sorry.
No, it's temporary. Yeah, right.
Yeah.
Do you know how much would be the stem cells?
You'd have to call the office at 800-300-9300 to see what's going on for you. Everybody's different.
Okay.
Okay.
Okay, and if I call the office, do you think I can get an appointment soon?
Yeah, if you email me, if you go to the website, hang on with us. We're going to go to a break, and then I'll give you the rest of the information, okay? Just a quick break.
Good.
Stay with us, Anna. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
Thank
You're
you.
listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.